AM 1430 KRGI and 105.5 FM. Good morning. I'm Brian Gallagher, a guest in studio from Central District Health Department. Nicole Placke is here to talk about a week that is being observed. First off, welcome back.
Good morning. Thanks for having me.
So did it feel good outside? I mean,
to me it is. Yeah. Anything over like 30, great.
I
Perfect.
get it. Yeah. And we've been waiting for this.
And the sun shining, can't complain.
Bring it. Got to 60 yesterday. Oh, yeah. Close today. Oh, yeah. But let's get back to business here. We're going to talk about HPV Prevention Week, and I'm going to let you just start, and I'm going to listen.
Sure. So HPV stands for human papillomavirus. About 80% of people will have HPV in their lifetime. A lot of the time it resolves on its own. When it does not, it turns into cancer. And I think people are most familiar with cervical cancer. About 90% of cervical cancer is caused by HPV.
Is this something that's a relatively new discovery or awareness? Because being old enough to understand cancer and having seen some folks that have had their battles with it, but HPV seems to be relatively new terminology.
Sure. So I think with the development of the vaccine a decade or so ago, it really came back into the spotlight, and people took more of an initiative as to prevent it with the vaccine.
So they do have one weapon that so far has shown good results.
Yes.
All right. What are the age needs that people need to be aware of in regards to HPV?
So any age for HPV overall. For HPV vaccine, you can start getting vaccinated as early as 9. The recommendation is up to 26, but recently they extended that to 45. The other thing, especially with women, is just to have your yearly exam or however often your doctor recommends you have a PAP.
So for those of us who are on the other end of that age scale, we just wish good luck. I mean, is it because, let's face it, if the vaccine is not going to be a tool, there's really no need to take it.
Correct. Yep. So just those age ranges that I talked about. If you are concerned, you can talk with your provider if you have any outlying risk factors.
Are there symptoms that folks should watch for just in case they're just not sure? Or is this something that really everyone in that age group should get that vaccine?
Everyone should get it. Most people, you would never know you have it. It doesn't really present with any sort of illness symptoms. Really, it's mostly caught when you get your pap smear and they test for HPV.
All right. We're talking with Nicole Placke from Central District Health Department. It's HPV Prevention Week. So the shot itself, the vaccine, is it something that is readily available? Is it something from a healthcare provider, insurance, that type of coverage? Fill me in.
Sure. So your doctor's office, most doctor's offices provide it. We have it at the health department. It's available regardless of insurance status. So if you don't have insurance, we have some supply for you. Otherwise, insurance does routinely cover it.
So if folks are curious, like me, and they want to know more and really want to know what's the next step, what is the next step? How do they find out more?
Talk to your doctor. If you're not someone who goes to the doctor often, you can call our office. You can ask for me by name, Nicole. Our number is 385-5175.
There you go. All you need to know about HPV, it's HPV Prevention Week. And as that famous Nebraska guy said, get her done.
Thanks, Brian.
I made her smile. Oh, now she said, I get to go outside. I'm ready to go. Nicole Placke from Central District Health Department. Good morning from AM 1430 KRGI 105.5 FM.